Hi, I'm Lawrence Bergstrom, registered osteopath and non-surgical spinal disc specialist. In this video today, I thought I'd talk to you about something a little bit different, a less technical video regarding spine and spinal problems, and more of a personal experience of spinal problems. It might surprise some people to know that osteopaths suffer spinal injuries and spinal problems too, and I'm certainly one of those. Going back to my early 20s, I was an elite level sports person. I was an elite level sportsman. Outrageously fit, very strong, I believed very healthy. Until one day my world turned upside down, where I found myself completely disabled by spinal pain and housebound for 18 months, unable to walk, unable to climb stairs, just a cataclysmic shock. And that journey took me to where I am today, but at the time, it, as you might imagine, and you don't have to be an elite level sports person to suffer the same experiences, but when I was so focused on sport and competition and being the best I could and getting the very best out of myself, to then find myself not just with a common or garden perhaps sports injury or a muscle strain or a ligament sprain, the types of things that sports people are particularly prone to and aware of. This was on another level, and innocuously, of all things, it developed through pulling my jeans on. It was as simple as that. I'd had perhaps some low-grade twinges in my lower back on occasion before the main event happened, but prior to that, nothing that I gave any thought to. And then one day I was simply pulling my jeans on and I felt a snag, a slight pinch in my low back, and within 72 hours I found myself unable to get out of bed. I found myself stuck on the floor as well. I couldn't get up, and things deteriorated very quickly from there on. And I spent a long period of time in the house. Now, we didn't have the knowledge so much then that we have today, but my journey through spinal pain was quite a harrowing one. Of course, I did what anybody else would do. We rang the doctor, and the doctor came to see me and said it's a muscle strain. So I was given some medication and told just to rest and it would get better. And then from the point of it occurring to several weeks later, it was getting worse. So I then managed to drag myself to the surgery and saw another doctor who said, yes, it's a muscle strain and to take more medication and just to give it time and things would gradually get better. And they didn't. So then I was referred to a physiotherapist at that time, and I should make it clear at this point that I was unable to sit down at all. I could stand or I could lie down, and I couldn't sit at all. I couldn't bend forwards at all. So it greatly limited what I could wear. It greatly limited my movement in any way, shape or form. So, visits out of the house were a nightmare. It was impossible to get in a car really without lying down on the back seat of a car, which obviously is very dangerous as well. So I was then sent for physiotherapy, and I had a number of sessions which didn't improve the situation at all. Nobody seemed to be able to tell me much about the problem. other than it was muscular and to do exercises and to take painkillers, and the exercises made things worse or didn't help. The pain medication at best took the edge off, perhaps, the pain a fraction, but I wasn't getting any better. If anything, over time, I think I was still progressively getting worse. And by this time, I was really at the end of my tether. I hadn't, despite being an elite level athlete, I still had to work part-time. And you're living on a shoestring at that time because you're pursuing what you love, you're pursuing the sport that you love, you're competing in that. You're not yet a professional, so you're not making a living at it, but you have to live like a professional. And at the same time, you still have to pay all your bills and make ends meet. So, being part sponsored helped a little bit, but I still needed to work, and I couldn't work. And I hadn't worked for weeks, which then turned into months, which ultimately ended up turning into 18 months. So I went back to my doctor again, and he was a bit irritated with me by this time and said, well, what more do you want me to do? And I said, well, I want you to help me. That's what I want. I want to get fit. I want to get well. And he said, well, what do you expect me to do? And I said, well, perhaps an X-ray might be useful. And he agreed that might be of value. So he referred me for an X-ray, and we had the X-ray, and I was hopeful and perhaps even quite excited that we would get to the root of the problem here, and then we could say, great, there's the problem, there's a solution, and this is the way forward. The X-ray came back clear, nothing wrong at all. So you can probably imagine at that point how disappointing that was, to say the least, and just to have my doctor speak to me and say, Lawrence, your X-ray says there's nothing wrong with your back. So that was a really bleak place to be, and by this time, if you can imagine, you're having a strip wash at the kitchen sink because you can't climb stairs. You can stand for short periods of time, but I couldn't walk more than probably 40-50 meters. You can't sit down at all. You can lie down for hours with, interestingly, very little pain. And I say interestingly, I mean, I now know why, but back then I found it strange that if I lay down and I had next to no pain, and this was a clear diagnostic marker which no one was picking up at that time. And again, I think in fairness, partly perhaps the knowledge wasn't there, perhaps I was unfortunate in the medical care that I had, not being the most focused towards spinal injury and spinal pain. But so I was housebound, and during that journey I became depressed, clinically depressed, to the point where I did in the end up being prescribed antidepressants. I'd lost my girlfriend, and I understand why, because by that time I was just a complete misery, a total misery, and just locked in this daily constant battle with pain every day, all day, and the only thing that relieved it was lying down. And as you can imagine, you can't live your life lying down. My friends stopped calling because in the end, A, I was so miserable, B, I couldn't see a way out of this, it had been so long now, and C, how do you go out with friends when you can't walk any distance, you can't sit in a car, you can't sit at a restaurant, you can't go to see a band, you can't go to a sports event, you can't go to the cinema, you can't do anything. So your friends are sympathetic, they come and sit with you for a while, you're depressed, you're deeply miserable, you're in your early 20s, you feel that you should have the world at your feet, and everything has just imploded. So it became a very lonely time. And further to that, the doctor was telling me there was nothing wrong with my back. So I went back again, and again, the GP, and this is in the days where you did have the same GP most of the time, So again, the question was asked, Lawrence, what do you want me to do about it? And I said, I want you to find a solution to my problem. I believe there is one. And so his solution to my problem, which all these years later, I understand it more, I get it more now, but his solution was to refer me to a psychiatrist. And it meant, and I was living in Kent, and the psychiatrist practiced at a well-known London hospital. So it meant getting there first. But I was under the impression I was going to see a specialist, and of course he was, but he was a specialist of psychiatry. And the journey from Kent to London felt to me as well, it may as well have been Australia. It was so far to go in agony. But I dragged myself there, and I got there, and I arrived early despite everything, and I handed my admittance letter into the reception desk, and I was told, yes, if I'd like to go down to the corridor and sit and wait, and I said, well, I can't sit. And so I just stood there. And then I walked up and down the corridor, and I was looking at the nameplates on the doors. And the particular doctor that I'd been referred to, or the consultant I'd been referred to, under the on the nameplate, it said clinical psychiatrist. And I thought, I must have made a mistake. So I went back to, shambled back to reception and said, I must be in the wrong part of the building. And the receptionist said, no, you're in the correct place. Professor or Mr. whoever it was, I can't remember his name now, will see you shortly. So he did, and I explained to him that I could lie down or I could stand. So I had this rather bizarre consultation with me standing or propped up on a desk, and he was asking me questions about my childhood and my everything, my love life, and did I have a girlfriend, and how was life at the moment. And I said, well, as you can imagine, pretty awful, because I'm in agony all the time. And he said, okay, well, I'm going to prescribe you some medication, and he did so, and I thought, okay, well, this might help. And he didn't say a lot else other than that. I did ask him, do you think you can help? And he said, yeah, I believe we can, but he didn't go into specifics, and perhaps I was a bit naive and a bit too trusting and assumed, well, I'm in the hands of a consultant now, so this must be a good thing, and we're going to find the way forwards. So I received my prescription, and I went to collect my prescription, and they had funny names, as medication does, as you know, and I went and looked it up, and I realised I was on some stronger, really sort of bordering on psychiatric drugs. And I thought, there was no way in hell I'm taking these. I simply refuse to believe that the pain that I'm in is a result of my thinking. So, GP yet again, we fell out at this point, unfortunately, because I think he was sick and tired of me seeing him, and I was sick and tired of going to see him. And he said, well, there's nothing more I can do. There's nothing. And I said, well, can you not refer me to an orthopaedic consultant, and so on? And in the end, he did, but he said it's going to be, even back then, it's going to be months and months and months before anybody sees you. So I then took it upon myself to start looking elsewhere, and I was so desperate to try and get fit and well again. And so that journey took me through private healthcare. I saw private physiotherapists, I saw chiropractors, acupuncturists, homeopath, massage therapists, tried exercises in the gym. Nothing worked, and I was still in as much pain as I'd ever been. And I should note at this point that MRI imaging wasn't really widely available at that time. It wasn't really something that was in the mindset, I think, of a lot of medics and clinicians. Now, as a doctor of osteopathic medicine myself, I recognise I have huge benefit in being able to refer for or huge opportunity in terms of being able to refer for medical imaging, which is very broad and vast now, from the different modalities, from plain X-ray to different types of MRI scan, whether it's standing or seated, or what we call supine, lying down, CT scans, MRI scans with contrast dye, ultrasound scans, x-rays and so on. So there's a huge amount of information that we can gain very quickly for our patients these days. But when I was a patient at that time, nothing seemed to be forthcoming. So one day I was at home, very, very miserable, very low, and I will add, because it's not customary and it's not usual for doctors and practitioners and clinicians to discuss their own problems with their patients, which is why I thought I would shoot this video, because I think it's important for patients to understand that there are clinicians and practitioners out there that understand it, not only medically, not only academically, but understand it physically and emotionally as well. And we're fairly unique in this clinic in that myself and my team have all suffered spinal injuries and spinal problems. So we understand the very real emotional and psychological and physical and financial impacts it has upon us. So during my journey through the various private avenues, I was bleeding money by that time. I was spending money that were really with my life savings, because bearing in mind I hadn't worked for months. And that's something we experience with some of our patients. Their pain has been so severe and impacting, they've had to stop work, or they've had to change careers and so on. So, we see that. So I was running out of money fast, and yet I was still throwing money at trying to find a solution. And I'd more or less given up. And by this time, I will openly say and admit that I was, you could say, clinically depressed. There were no highs, there were no lows, there was no positivity in life anymore. Nothing was good. My sense of humour had long since gone. Nothing that used to interest me and excite me and stimulate me had any kind of effect anymore. I was just an emotional flatline, to the point where I did develop suicidal ideation and contemplated ending my life. And I think two things that perhaps drew me out of that. One was, if I ended my life, somebody would find me, whether that's a professional, whether it be a member of the emergency services, or somebody, a member of the general public, or a family member. And so even in my darkest moments, I thought, I don't want to inflict that on somebody else, because for the rest of their life, they find me somewhere. And the second thing I thought was, and I won't take full credit for this, it was a dear friend of mine at the time, said, but you can still think, you can still feel, you can still sense, you can speak, you can talk, you can hear. There are people worse off than you, Lawrence. And as hard as it was to accept at the time, because I was in such a miserable place, I knew they were right. And so I thought, okay, I need to find a solution to this somehow. Nobody else is finding it for me. I'm going to have to find it for myself. And I don't know whether you believe in fate or serendipity or random chance, but the phone rang one day, and a good friend of mine got in touch, and he said, so how's your journey towards an Olympic gold medal going? And I said, don't even ask. And he listened, and he said, okay, you need to call Frank. And I remember thinking, who's Frank? And he said, you need to call Frank. And sounds a little bit like a line from a Guy Ritchie movie, you just need to call this guy Frank, and he'll come and sort it all out. So I did call Frank, and it turns out Frank was an osteopath, and he'd worked at the Olympics, he'd worked for Team GB, he'd worked on the Tour de France, you name it. And I dragged myself to his door, and he was the first person out of everybody that I saw, and I'd seen a lot of people. And in our clinic, we meet with people every day that say, we might be wasting each other's time because I've seen everyone. And back then, that was my experience as well, but I hadn't met Frank. Now, Frank was very direct. He was immediate in his diagnosis, and he was proven to be entirely correct. And I had two key problems. I had a significantly prolapsed L5-S1 disc, and I had a leg length discrepancy, which is to say my right leg is 1.5 centimetres longer than my left leg. So my pelvis was skewed, and I'd also majorly prolapsed a lumbar disc. And so that was in a hell of a state. So Frank set about gentle treatments. We didn't have things such as non-surgical spinal decompression equipment then. And it was a long journey, and he was very, very explicit. He said, Lawrence, it'll be at least 6 months before you start to feel you're walking reasonably well, you can sit for longer, and you're starting to feel you're putting this problem behind you. And it's going to be 12 months or so before you start to really feel you've recovered and you're rehabilitated, and you can then start to live your life again. And he was correct. He was absolutely correct. And what I learned from that at that time, and this is something that we practice extremely vigorously in my clinic, is that diagnosis. Diagnosis is key. You know, I'd seen so many people, and they tried this and they tried that, and they gave this a go and gave that a go, and some people were brave enough to say, oh yeah, well we'll get this sorted out for you, Lawrence, we'll get you better. But at no point were they explaining what was the underlying problem. And without a diagnosis, everything else is shooting in the dark. Okay, so when you see a practitioner, always seek a diagnosis first. Now, you can't always arrive at it straight away. I mean, 9 times out of 10, I would say, in lay statistics, we arrive at a diagnosis in the clinic at the patient's first visit. But there are times when we need to lean on the medical imaging I discussed earlier, blood tests, and maybe an opinion from another medical professional. But however that comes together, the history, the narrative, that is to say the story of the patient, what they're experiencing and suffering, medical imaging and thorough physical examination are key to arriving at a diagnosis. Once you have a diagnosis, then you have a prognosis, which essentially for non-medically minded people, a prognosis is that you believe within a certain period of time that patient's symptoms will be improving or resolved, and then that part in the middle, the management plan, the therapy, the treatment, can then be explained when you have diagnosis and prognosis. Without the diagnosis, there is no treatment plan, or shouldn't be, and there is no prognosis. So for me, I went from no diagnosis, management, treatment, no prognosis, because nobody told me what was wrong. So you can imagine, for me as a patient, that was a horrible place to be, coming home, speaking to people, how was your treatment? Good, I guess. How are you feeling? No, better. Did they tell you what's wrong? No, nobody seems to know. So I thought I'd share this video with you because, you know, we are very sensitive to the experience and the journey that our patients go through, and we understand it. And I see this with patients because often they're sat in front of clinicians, practitioners that are fortunate enough to have never experienced the problem themselves. And yes, you can read an awful lot and you can learn a lot academically about a problem, and you can still help a lot of people, but I don't think there's anything like the painful experience of having been through that your patients have been through as well, for you to really understand it. And then when you've also had extensive medical training and you understand it from an academic, anatomical, pathological, physiological perspective and an experiential perspective, it's a very powerful combination in us being able to help you. So wherever you go, if you have spinal problems, nerve problems, number one, you want a diagnosis, okay? Because it can save you thousands of pounds privately. It can equally save you an awful lot of heartache and pain and anxiety if you're going through the NHS route. And I worked in the NHS for 10 years as part of a multidisciplinary team. And I still saw many patients in the NHS that said, Lawrence, I've been here, I've been there, they don't talk to them, that practitioner doesn't talk to them, I don't know what's going on. And said, right, as of today, let's work at arriving at a diagnosis. Let's get to the root cause of what's causing your problems, and then we can start really developing an intelligent management plan. Okay, so yes, osteopaths do suffer spinal problems too. I'm very glad to say that with Frank's wonderful care all those years ago, the knowledge that I went on to gain, and then of course out of something awful, no, I didn't turn professional. It wasn't my spinal injury, I hasten to add. So if anybody's thinking, well, what's the end to that story? Did you turn professional? The answer is no. And it wasn't my spinal pain that prevented that. The reality was I was a good elite amateur athlete amongst other good elite amateur athletes, but I wasn't going to be in the great, and that's where you need to be if you want to turn professional. So if you like, my path diverged at that point, and out of something awful, something terrible, something that nearly ended my life, here we are all these years later, helping so many wonderful people out of the same problems and back to the life that they love. So diagnosis is key. Thank you for watching this video. I hope you found it interesting, and thank you.